Nystatin suspension, final dose form, is used to treat fungal infections of the mouth. It works by stopping the growth of fungus. It should not be used to treat fungal infections of the blood. The daily dosage and optimal timing for taking this medication should be directed by your doctor. To use Nystatin suspension, final dose form, follow your doctor's instructions and take it usually 4 times a day. Make sure to shake the bottle well before each dose. Use a special measuring device/spoon to carefully measure the dose. Avoid using a household spoon because it may not give you the correct dose. Here's how to use it: place half of the dose in one side of your mouth, swish it around, gargle, and then swallow or spit it out as directed. Keep the liquid in your mouth for as long as possible, then repeat with the remaining half of the dose in the other side of your mouth. Avoid eating for 5 to 10 minutes after using this medication. It may take from several days to several months to finish treatment. Use this medication regularly at the same times each day to get the most benefit from it. The dosage is based on your medical condition and how you respond to treatment. Keep using this medication until the full prescribed amount is finished, even if your symptoms go away after a few days. Stopping the medication too early may allow the infection to come back. If your condition lasts after several days of treatment or gets worse, make sure to tell your doctor. Possible side effects of Nystatin suspension, final dose form, may include mouth irritation, diarrhea, nausea, vomiting, or stomach upset. If any of these effects last or get worse, tell your doctor or pharmacist promptly. This medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including fast heartbeat, wheezing, muscle pain. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Remember to consult your doctor about the daily dosage and the optimal timing for taking Nystatin suspension, final dose form, to ensure maximum benefits. Before taking Nystatin, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have HIV disease, diabetes, or kidney disease. Since this product contains sugar, it's important to use caution if you have diabetes. Ask your doctor or pharmacist about the safe use of this product. If you wear dentures, it's important to properly clean and maintain them during treatment with this medication. Before any surgery, be sure to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this drug passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking Nystatin suspension, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. It's crucial to follow your doctor's instructions and not make any changes to your medication dosage without their approval. This will help ensure the safe and effective use of Nystatin suspension. If you or someone else has taken too much Nystatin suspension and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. It's important to remember that Nystatin suspension is prescribed specifically for your current condition and should not be shared with others. Also, do not use it for any future infections unless instructed by your doctor. If you forget to take a dose of Nystatin suspension, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular scheduled time. Do not take a double dose to make up for the missed one. Keep the Nystatin suspension at room temperature and away from heat and light. Make sure not to freeze it and avoid storing it in the bathroom. Keep it out of reach of children and pets. Do not dispose of the medication in the toilet or drain unless instructed to do so. When the product expires or is no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.